Hey everyone, Dr. Alex Ritz, downtown Toronto neurostructural chiropractor, and this is Lunch and Learn TV. And I do have to apologize. This is supposed to happen on Monday, but I had a little mishap on my travels, and I was relieved of my cell phone. I didn't have a cell phone on Monday, so anyways, we are live. We're here today, and we're going to be going over our hip strengthening protocol level 3. So our hip strengthening protocol level 3, it is a great protocol if you want to focus on your glutes, whether it's for back pain, for core strength, for sports performance, or in our case, we're still going strong with our strong knee series. And with our strong knee series, that the stronger your hips are, the better off your knee is going to be. And just as a little bit of a recap, when we talk about our strong knees, we've discussed so far that most repetitive strain problems of the knee are not actually knee problems, but rather an ankle issue or a hip issue. And to rephrase this, most knee issues come from too much side-to-side movement, and too much torsion or twisting at the knee or side-to-side movement is going to cause some repetitive strain and some pain. So you might have been told patellofemoral pain syndrome, a meniscus issue, chondromalacia patella, something along those lines. Nerves in the joint are irritated, sending a pain signal to the brain. And usually you can think of it as 10,000 steps a day like this, or the knee as a result of not enough strength in the hips, or that ankle collapsing and pronating inwards because of either flat foot or weak ankles. So today we're going to continue on talking about some hip strengthening exercises that you can do to, I think these should be done by everyone all the time, but if you've got a knee issue and you want to start rehabbing or prehabbing, focusing on this, stuff's going to be really valuable today. I do recommend that you go back through hip strengthening level 2. And so actually what I'm going to do, guys, I'm just going to turn off my Wi-Fi because it is... Okay, we're off the Wi-Fi, now we're pure data. Go back through hip strengthening level 1. You can download that in the link in the bio. Hip strengthening level 2 we covered last week. I think it's floating around the internet somewhere. I will try and get it posted. Hip strengthening level 3, when you can progress through 1 and 2, we go on to this. These are really great exercises. You're going to need a couple things. You're going to need a TheraBand. The TheraBand we're going to use today, a TheraBand tied into a knot, is a longer TheraBand. So we're going to go through 5 exercises today, guys. Number 1, we're going to start off with the wall push with external rotation. So with this, we're going to get our trusty TheraBand. We're going to loop it around the hips. And unlike the other exercises, the higher that this one goes, in terms of the mid-thigh, the more difficult it's going to be. To do our wall push with external rotation, we're going to find a wall. We're going to stand on one leg. Oh, one leg's going to come out. We're going to be pushing into the wall, so driving inwards into the wall, and then my one leg is going to be elevated. And we're going to have our core nice and braced as we usually would. We're nicely stacked up so that our posture and our structure is aligned. And then for the external rotation component, we're going to move our foot inwards, just like that. And you move it as far as it goes without it being painful. You can either hold it for a minute and do 3 sets of 10. Now, the importance of the resistance band is it's going to force me to activate the glutes and the external rotators to keep my leg outwards. So I'm activating those, and you'll notice that when I move, the only thing that moves is my foot. There's no inward movement of the knee, and when you start doing a few of these, you're going to really feel it in the piriformis and some of the gluteal muscles right in the glutes. This exercise, again, is going to help draw that leg outwards when we're doing activity and keep the knee in a safe position. The next one we're going to do, we're going to do our external rotation exercise, but with some trunk activation. So this is where we're going to use our longer TheraBand. And so for this one, we are going to be in a slightly different position. There's going to be no external rotation, but we're going to have our leg up. We're braced on this side. We're pushing into the wall. And for this one, we're going to be keeping our spine nicely stacked and raising our hand up to the ceiling and then down. And then obviously if you take up more slack, you're going to have more resistance. Now this one I'm going to show everyone from the side so that you can see a key distinction that we covered in one of our Instagram posts the other day. So with this trunk activation and arm raise, what you'll notice is good technique is where ear, shoulder, hip, knee, ankle are all nicely stacked up. I'm on my one leg, and that when I bring my arm up, my position doesn't change. I'm still nicely stacked up. I'm going to be really targeting this glute that I'm standing on but there's no change in position of my core or of my posture. Now, poor technique would look something like this, where my core is moving or I'm losing that nice stacked up spinal posture with sets. So with the arm raise and trunk activation exercise, again, you can hold it for a minute. I think this one's better with 3 sets of 10, of course, doing it on both sides. Our next exercise, we're going to be going into our external rotation drill, but with this one, we're not going to have the wall for support. So similar technique, we're going to have our circular resistance band up around mid-thigh, standing on one leg. And this one is going to be no wall push, so I have to be extra stable through the core and through the hips. And we're going to be, again, rotating the leg inwards, holding either for 1 minute, or doing 3 sets of 10. And again, you'll notice that I'm nicely stacked up and level in the front. There's nothing moving except for my hip joint. I'm not shifting back and forth like that. And then if you look at me from the side, hopefully, I'm nicely stacked up again. And the only thing that's moving is the hip. Doesn't hurt my knee. All that's moving is the hip activating the glutes. So that's exercise number 3. That's our external rotation drill, standing, no assistance from the wall. Next drill that we're going to go on to, oh, this one's a doozy. So in hip protocol 1, you'll see we talk about the fire hydrant. So the fire hydrant, again, is when we are down on all fours and then moving nothing except for the hip joint. That leg comes out to the side, and we can hold that like a dog, either for a minute, or we can do 3 sets of 10. This one's a little bit more challenging. It's going to be a standing fire hydrant. So the standing fire hydrant is a lot more challenging because we're going to be on one leg. And one thing that's really, really important to think about when we're doing this standing fire hydrant is that, just like this, there's no movement of the spine or the core or the trunk. The only movement is in the hip joint here. So you'll see that if there was a ruler here, the only thing that moves, whoa, if I can get it properly, the only thing that moves is my hip joint. There's no movement twisting through the core or through the trunk. It's just all in here through the hip. So good technique would be here. Level through the hips. I'd be nicely braced and stacked up through the core in terms of the alignment between my ear, my shoulder, and my hip joint. They would be straight. And then this is just held out here, activating the glutes and the external rotators. I'll show you this one from the side because I think it's important to see it. So, nicely in a squat position. Fix my gaze somewhere so I don't tip over. And then the leg just comes out here to the side. So you'll notice that when I do this, the only thing that moves here is the hip. Core and trunk are nicely aligned, and I'm really feeling the burn. Now, don't make the mistake of bringing the leg up and out. It's back and out to a 12 o'clock, 1 o'clock position there. Woo, that was tough. And then the last drill, guys, that we're going to do in our hip strengthening protocol level 3 is we're going to do a Bosu ball knee raise. So I don't have a Bosu ball, I just have this lovely plush pillow. And so for this one, what we do is we get down on our Bosu ball, and we're going to be just on one leg. And then for this one, the TheraBand is still around the hips, and then we just bring the leg out to the side, similar to the fire hydrant, and try to stay stable and nicely stacked up. Now, as you can see, I'm on a pillow which is relatively stable, and this drill is still quite challenging. So from the other side, this one we want to stay as stacked up as possible, and bringing the hip back and out like this. This one, I think, for stability reasons, is a little bit easier if we do 1 minute holds as opposed to 3 sets of 10. But it's a really fantastic drill. It's going to build some core strength, challenge the core, work on your stability. So I think those are 5 really, really good drills that if you guys are getting bored or you need some new material, or in general you just think that the hips could be a little bit stronger to help with your knee, your spine, and your core, I think that's going to be really, really valuable. In a few weeks' time, got a little bit of work to do. We're going to try and have that up in a download or a paper version. This will be loaded on our Facebook page, so check out our Facebook page if you want to re-watch this video. Otherwise, some exciting stuff that's coming up in the next couple weeks. We're going to be going on and doing our hip flexor and psoas series. I'm really, really excited for this stuff because this is our bread and butter. We're going to be talking about spinal structure and nervous system function, which we do really, really well at our office. We're going to be talking about how the importance of a well stacked up spine and structure is really important, and how the hip flexor psoas can throw that off. We're also going to be giving away lots of good tips, drills, stretches, valuable information so that you can take better care of your hip flexor, which if you sit all day, it is almost guaranteed is a problem even without getting assessed. So I hope everything today, guys, was really, really valuable. Like, comment, share. The more people that I can speak to, the more people that we can help live a more fulfilling and healthy life. That is all for today. That's Lunch and Learn episode TV. Lunch and Learn TV. Yeah, episode 25 in the wraps. If anyone has any questions, please direct message me. I try and get back to everybody if you give me a couple days. And I hope everybody has a fantastic Wednesday, and I will see all of you next Monday for Lunch and Learn TV episode 26. Peace!